Welcome in. It is the local and community issues and answers right here with Jonathan Lawson. Special guest today, Vicki Prince she's the Community Resource Coordinator for Hospice of Corbin. Good to see you, Vicki.
Thank you for having me.
And we appreciate your services. Tell us about your services.
Well, Hospice of the Bluegrass provides quality end-of-life service for those whose quantity of life is limited. So we have a team concept of nurses, nurse aides, social workers, and chaplains who go out and visit with patients and their families and try to improve or add to the quality of life, restoring dignity to those in this phase of their life. And
there's so many people that can use these services. I mean, you know, this is a hard time for people and their families.
Very much so. Death and dying is one of the hardest topics to talk about.
Right.
And it's difficult for anyone at any stage of life,
right,
especially at this time. And so we try to come in and help folks with any answers that or any questions that they may have, and try to ease their mind about things. We try to help them with their medications, just overall anything that we can do at this time.
Well, there's so many people right now that may be watching this that may need to contact you even today and ask you some questions. What's some of the basic questions and answers you could give people, like answers to their questions? Like, how do we get your services?
Okay. The first thing I'll say is you can give us a call at any time during the day at 606-523-3090. And we have staff that are there during the day that can answer any questions or take referrals. We have a website that is www.hospicebg.org, and they can go online and check out many different aspects of hospice, not just who we are and what we are, but what we do.
Right.
And they can give us a call, and we can even come out and talk to them at home. We can even go to the nursing homes if we need to. And if someone is in the hospital and they have questions, we can go out and do a consult at the hospital also.
When is the best time to contact you? I mean, when's the best time? When's the right time for hospice?
Well, that's a hard question, and that's a question that we do get. And sometimes it's best if folks ask their doctor even. You know, sometimes it's hard for a doctor to bring that up. Maybe it's time to call hospice. They're reluctant to do that. So sometimes it's good for families to do that.
Right.
Generally, a prognosis of 6 months or less is when someone is told that, then they can give us a call. As soon as they get that prognosis, we would love to come in, because establishing a relationship with the patient and family, establishing rapport with them, always helps.
Yeah.
That way they can put their trust in us, and we can help out with, like I said, medications. Sometimes medications are not given at the right times that they need to be and the right dosage. So we like to come out and the nurses take a look at that. Sometimes there are services out there that our social workers are familiar with that families need to access also.
And you know, I just love how that you got different things here, like different categories, like the chaplains and the nurses and things like that. People that's caring for people and willing to come to people's house and you know, encourage them and talk to them.
Exactly.
You know, because that's a lot of biggest thing is people need counseling, and they need you know, to calm down, you know, sometimes.
Right. And guidance is one thing that our chaplains do.
Yeah.
It's not just spiritual care for those who are spiritual.
Right.
There are those that are out there that are concerned about the end of life.
Right.
They have questions.
Oh, yeah.
They have concerns maybe about things they've done in their past that are bothering them now. And our chaplains are not judgmental at all. They give respect to all beliefs, all denominations, all religions, or even non-beliefs. You know, there are those out there who do not believe in any spiritual guidance at all. And so they're there just for support. They're there for prayer, for Bible reading, just generally just to help out the family and patients in whatever they can do.
Now, how does it work with the nurses? Is it around the clock or the evenings, or how is that?
A nurse will come out and visit once a week.
Okay.
That's generally what they do. Of course, if things come up, then a nurse can come out other times also.
Right.
Generally, it's once a week. Nurse aides can come out up to 5 times a week.
Very good.
We do have continuous care, which is a part of hospice. Those that may have a skilled reason to have a nurse on hand 24 hours a day, or at least for an 8-hour time frame, then we do have those available also.
Okay, and now what's the majority of the area that you serve? Corbin, London,
We serve Clay, Knox, Laurel, and Whitley counties.
Very
So we
good.
come to all 4 of those counties, and our staff actually live in all of these counties just about.
Very
So
good.
we have folks that are from Clay County, and we have some that work and live in London. So
Now, how can people that's watching this program today, how can people get involved and help hospice help others?
well, that's a great question. I love that question. Part of the component of hospice is having volunteers, and that is how hospice started.